Hello, so we're going to commence a Skinova Elite treatment. This is a truly pioneering cutting-edge ultrasound-based system, and we're going to put it on the skin tightening mode for today. So that's the protocol we're going to be doing. It's essentially delivering, in this case, for this protocol, 3 different frequencies, 1, 3 and 10 megahertz of ultrasound waves simultaneously. But it's doing it in lots of sort of micro pulses, and that's the real magic of this technology, that as far as the cells are concerned, they don't really know they're getting interruptions between these different frequencies. As far as the cells are concerned, they're getting all 3 continuously at one time, and that has quite a very special magical effect on the cells in what it does, and I'll talk about that in a minute. So let's go to Jane here. So Jane's got a beautiful face. She does look after her skin. She uses topical growth factors all the time, but we're going to start in the key area where she'd like some more tightening, which is the lower face and also the neck. Very common for people to complain of that area. The machine is on. It's easy to use, and I'm going to press start. The probe I need even lights up. As with all ultrasound, you always need a little bit of gel to act as a medium when you're making contact with the skin. Now, the real beauty of this system, to be honest with you, I'd have it even if there was discomfort, but it ticks every box. And what everyone wants to know is, am I going to have any pain? And the answer is no, 0 pain. And Jane's going to show us that in a second. So we're going to start now. So Jane, tell us, what can you feel?
I can feel nothing or no pain.
There you go. So at most, Jane may get just a little bit of a heat sensation, but no discomfort at all. And I have to say, to use this device, I need very little skill. It does it all for me, really. And as you can see, I've already done the very bottom bit of the face by the jawline. The light being there continuously tells me that I'm delivering the energy, it's doing what it needs to do. If I lifted it off, you can see it starts flashing and beeping at me, telling me there's a problem. Still no sensation?
Very, very slightly warm.
Okay. I'm always tempted to do just half the face just to see how people are over the coming weeks, but we won't do that to Jane. And this is really it. The beauty is, though, for this device, is that there are loads of protocols. So we can, deep wrinkles, superficial wrinkles, skin tightening, and then of course we've got various conditions that we can manage. So aside from rejuvenation, there's a whole dermatological setting or section on the machine, from scarring to wounds, pre and post surgery. This is brilliant. Significantly accelerates wound healing, and we'll now be using this in combination with topical growth factors. We can also treat 4 out of 6 types of psoriasis, acne, cellulite, dermatitis, and it's not just about treating, it's actually about giving long-term improvements. So there are numerous studies, there are tens and tens of peer-reviewed journal publications on this technology showing long-term improvements. Some of their longest term studies were on cellulite and acne, and even at 9 months, even over a year, showing that people were in remission and hadn't really had a recurrence of their issue, which is really, really impressive. So there's no downtime, no pain. We're not allowed to say anything is risk-free, but I struggle to see what risk there is from this system. which means that, you know, safety is obviously paramount. And that's what I mean by this ticking every box. The only thing, I guess, is that, you know, with some of our treatments, you know, you can come in and have literally 1 or 2 visits and you're going to get cracking results. You might have to wait a while. Whereas with this, we're generally saying that you need to have ideally at least 2 sessions a week for 5 weeks. So 10 sessions. Often people will get improvements after just a few sessions, which is encouraging for them, you know, to keep going with the course. But typically this needs a little bit more commitment. But, you know, when you've got such a safe, comfortable, no downtime treatment, the only thing you need to do is give up a little bit of time. But the treatments are very quick. You can do a whole face in about 30 minutes. And if you're doing a small area, we're treating a lady with, she had an infection after a facelift, surgical facelift, and the wound has left quite a scar. And unfortunately, that is now troubling her psychologically. And, you know, we're going to treat it with this. And although we've only treated her once, we'll share the results with you in a few weeks' time. And I'm pretty sure we're going to get some nice improvements. And that's quite a difficult scar to deal with. The next part of the protocol, move to the bigger device. Just so we can get what's this actually doing? Well, it would take a long time to go into the full science of it, but would you believe that there were some discoveries in the last 10 to 15 years or so of a type of cell in the skin that no one talks about, and a protein that no one talks about. And yet the science is there, the publications are there, the research and the evidence is there. So the cells, there is a layer called the DWAT layer, the dermal white adipose tissue layer. So these are skin fat cells, if you like, but they're very specialized cells that no one, barely anyone I know of has even heard of. And these are very instrumental in wound healing, inflammation, collagen stimulation. And there's also a protein called caveolin-1. And the expression of this protein, which is particularly in dermal fibroblasts, which stimulate collagen, and of course these fat cells I've been talking about. So for example, you may have heard of senescence, which is cellular aging. And during fibroblast senescence, when your fibroblasts are getting older and they're basically becoming a bit useless, but actually they can release signals that then make other cells useless as well. And what's interesting is there's an overexpression of this protein, caveolin-1, in this process, so in aging. So this machine, in a nutshell, is actually regulating the expression of this protein. It's actually having influence in terms of the expression of the genes that make this protein. That's how amazing this machine is. And it's also helping balance the population of your dermal fat cells that we've just talked about. And by doing that, you can therefore influence anything, any process or condition where those fat cells are important or the protein is involved, you can then improve. Which means 4 out of 6 types of psoriasis where this protein is involved respond to this machine. Acne will respond to this machine. Cellulite will respond to this machine. And of course, aging. And many other conditions, wound healing, scarring, etc. So the number of applications for this technology is incredible, like nothing I've come across. And to then wrap it up in something that's super safe, with no pain, no downtime, for me is actually truly pioneering, and I think will change skin health around the world. And that is a dramatic statement, but you tell me anything else that comes close to this. So I've completed a treatment to the lower face, mid-face and neck for skin tightening. So ideally we'd now repeat later this week and then do another 2 a week for a total of 10 sessions ideally. Aftercare is pretty much nothing that's essential, although of course as always we're going to support this treatment with Selderma GF5, the topical growth factors, to help enhance the actual regenerative process that we're triggering with this treatment.